All right, warning, I might get a little bit fired up in this post. I'm going to try to keep it brief, but everyone out there needs to understand something about healthcare. You have to understand about the difference between sick care and healthcare. You have to understand the difference between people who want to help you and actually have your best interests at heart, and seeing medical doctors or whatever who may have to go through the insurance related steps in order to get reimbursements. Therefore, there's incentive, right? There's like incentive when it comes to your health. So like a lot of the reason, that I might feel in my life a little bit like, why aren't I getting those new patients or something, is when they all call and say, do you take Blue Cross? Do you take United? That's the generic way of saying, do you take my insurance? Do you bill my insurance? Me, I don't deal with insurance. Like I just never have, never will. I don't care how much money I leave on the table. I don't care. Like I don't care. I won't do it. And the reason I don't do it is because of literal examples of what just happened today. And I'm going to give this example to you. I am a portal of entry provider as a chiropractor. Whether or not anyone out there thinks that I should or shouldn't be, I don't care. Again, you're entitled to your opinion. But the reality is that I am a portal of entry provider. And what that means is, in certain aspects, I act as a primary care provider, which means if you come to me and say, I'm having pain here, there, and everywhere, if I was a dumb chiropractor who is an incompetent, then I would say, hey, let's lie you down and let's get you adjusted because motion is good and you're going to be better and chiropractic's a miracle. But because I'm actually a competent provider and I'm actually somebody who cares about you, if I felt there was a need to right away make sure we get imaging, which as a Gonstead chiropractor, I do image a vast majority of my patients. And what that means is you all have a very inexpensive, very non-harmful way to get preliminary information on your bone and spinal health, and that's with an x-ray. And if I felt that you had neurologic compromise or neurological integrity that could be compromised based on my examination, then I would send you for an MRI, especially with how easy and often it is for you to see things like disc herniations, disc bulges, spinal stenosis, ligamentum flavum that could be buckled and impinging on nerve roots and or the dura of the spinal cord. If you followed me with any of that, you see where I'm going with this. But when I get a phone call from my imaging center or from a patient or from anybody related in the realm of me writing a prescription or a requisite for them to get an MRI or an X-ray, and states that they need a peer-to-peer review in order for it to be authorized. By the way, they won't call me, the person writing the script. They're saying that I have to call them. And then I take extra time out of my day to call to get them this authorization. Do you know what I get told? I get told point blank by somebody who's acting apparently on their patient's best interest, in their patient's interest, right? Like they have their best interest at heart. They want to make sure that they're healthy. They want to make sure that they have no cysts in their spine. You see my thumb? They want to make sure they have no cancer. They want to make sure that they don't have a ruptured freaking, disc with sequestered fragments pressing all over their nerve roots and spinal cord, causing all sorts of symptoms. They want to make sure, but no, I have to call. Then I have to wait on hold and break through 3 barriers to finally get a hold of somebody. And then they say this, they say, there are too many mid-level providers writing irresponsibly an unnecessary imaging test. We have to make sure that it's warranted and it's responsible. The MRI will not hurt this person in any way, shape, or form. It's only having the insurance use that bullshit as an excuse because they're hurting the patients by delaying them to get the imaging they need, even though they're paying their premiums each month and probably going to be out of pocket on their copays and or deductibles anyways. It's an absolute disgrace in terms of that being what was told to me today, and that's the first time I've had to do that in X amount of years being in practice. First time that that's happened. And this guy's now, I look bad, and he's aggravated because he's going through like 2 weeks almost to try to get his Blue Cross to pay for his MRI. But I'm a mid-level provider who's ordering inappropriate imaging. I can't tell you how many times I've had people just pay out of pocket, or people that's insurance will accept the script. They get the imaging and they come back and unfortunately they do have cancer. Unfortunately, they have a cyst filling up a spinal space. They have a tumor the size of a grapefruit in their ovaries. I mean, I see this stuff so often, it's actually kind of disgusting. Because there's a reason people have pain. There's a reason people have symptoms. And it's not just because they slept wrong, which doesn't even exist. And it's not because they overstretched and had a mild sprain strain. That happens. But more than likely, 5 years of chronic pain right here that simply won't go away. You're going to want to not just have an x-ray, you're probably going to want to have an MRI to find out reasons why or why not. And then begin to not just adjust, treat appropriately or refer out appropriately. So it sickens me as a provider, a primary portal of entry provider, which I should be. And if it's ever taken away from me, I'll move to a state that I have the autonomy that I do here to get that there. Because I know the good that I do for my patients. I know the injustices that insurance tried to do out of just sheer not wanting to pay out. I'm not going to call it greed, just not wanting to pay, making it harder each time. Justify your case as to why we should cover your procedure. This isn't even a procedure. Over here, we're talking about a $300 imaging study. $300 imaging study. He pays more than that on a monthly premium. It's a disgrace. The system is broken. And that's just a fraction of a fraction of a fraction of a fraction of a percent of why it's so appalling and why insurance is so stupid. And here's the thing. Do I have insurance? Yes, I do. Should you have insurance? Yes, you should. But if someone ever calls me and says, do you take my insurance, and then doesn't come to see me and gets less quality care or gets ignored maybe or doesn't get a imaging study that they need to give them the best quality care and to get the answers they need, that is on you. That is on that person. That is not on me. And I can sleep at night, maybe not with the neighbor making noise upstairs, but I can sleep at night knowing that I did my best, that I did my job, that I did what was right for my patient and gave the necessary script, gave them the necessary referral, or gave them the necessary amount of chiropractic care or adjustment they need, period. Not because I'm great, not because I'm great, not because I'm wonderful. No, it has to do with the fact that what just happened today and what was told to me about being a mid-level provider ordering unnecessary imaging is a disgrace, and that should never happen to any of us when we have to get what we have to get the answers we need, to get the answers we deserve, because our health is all we fucking have. Have a wonderful Thanksgiving.